Good morning. Welcome to Salina Regional's Morning Medical. My name is Mike Maddock from the Marketing Department at Salina Regional Health Center. We've talked about cancer a couple times on Morning Medical. Going to look at it a little different perspective today, and that's with some nurses from the Tammy Walker Cancer Center who do the care of the patients there. So with me I have Sandy Ferguson and Sandy Cruz. Thank you very much for being on the show today.
Well, thank you for having us.
Thank you.
And we'll start with you, Sandy. Just kind of tell me a little bit about some of the day-to-day activities and what you see and what you deal with.
Well, I've been in the field for 25 years, and so I love oncology, and so usually we're all cross-trained, so many of us are chemotherapy certified, but there's more than just chemotherapy involved in cancer care. So a lot of times when the patient first comes in the door, they're overwhelmed. They've gotten their diagnosis, they've sat and visited with the doctor, and the doctor's talked about treatment, and so they are overloaded. So one of my first job as a nurse is to, educate them. And so let's get you on a schedule. We'll repeat things as much as possible. If you need to call us 25 times a day to get your answers, we are here for you. And it's just, I'm lucky because when I originally started, there was 3 of us, and now there's 22.
Sandy, from the chemo delivery.
Well, like Sandy said, we try to lead the patient, with first the teaching, and then they come back for their first treatment and they're nervous, and we try to make them relax by telling them everything that we do as we do it. I'd like to say that we at Tammy Walker try to treat the patient, not the disease.
Let's kind of talk about the team approach. And obviously we have 2 of the team members here, but having everything in one roof, that was the goal when we built the Tammy Walker Cancer Center. How does that help out with the families, and especially some of them from out of town and stuff?
It works out really well to have everything kind of housed as one, because we have radiation therapy also at Tammy Walker Cancer Center, and so many people do both treatments at the same time, or they can do them individually separate. One can get radiation and then chemo afterwards, or vice versa. But we're always in communication with each other, so that works out so well for the patient to be able to come in and have all their different treatments housed as one.
Well, thank you so much, and I say this a lot of times, but thank you for all you do, and really, honestly, I've seen the love that goes on in that room, and how that helps with the recovery. So thank you for being on the show. For more information, please visit srhc.com and like us on Facebook.